we're going to wrap up. Let me ask Courtney, here you are, come up here. We're going to recognize all the people that made this summit possible tomorrow, but and while there were a lot of people involved in this, the person with primary responsibility was Courtney. I don't think she slept in the last 6 months because not only has she been responsible for this and was told she couldn't screw it up, not only that, but she's been working on our governance restructuring and a lot of other work. And would you join me in thanking Courtney for a great program? And I want to thank our wonderful speakers today, Dr. Nash, Dr. Warner, really wonderful talks. I want to thank others that participated, Gary Fletcher, Sandy Gerke, Tricia Singer, Dr. Olberding, Mary Cronin, Bart Hill, and Marshall Priest. You know, if you weren't moved and impacted by what they said, then you really need some time to reflect and time away from these daily pressures, because that's got to get you. So really great stuff. I want to tell you there's a few things at your table. First of all, certainly hope that you will fill out the evaluation form that's at your table, because we'll take Sunday off, but starting Monday, we've got to start planning for next year's summit. So we need your thoughts and impressions. Please be honest with us. Tell us what you liked, what you didn't like, what you want to hear about. That's very important. Second, we realize that not everybody here lives healthcare every day. And if we talked about some things that you don't understand, please grab one of these healthcare acronyms and terms books so that you can look up some of the things that we tend to use our own jargon. Attached at your table is our one-page strategic plan. We're very proud of this. It's always evolving, but if you are unclear about our mission, vision, how we're going about accomplishing this, our strategic initiatives, this is a great summary document. There's the Christmas card that Dave Behunin helped us with, and certainly if you want to make a gift, as you could see from him, even a gift of $200 would buy one of those tablets for us to use. And then there's the card that I talked about for my blog. I hope you'll be following that. I want to thank you for giving up your time today to be with us. We're going to have a great session tomorrow, and you're not going to want to miss that. I do want to just make a couple of observations and comments. Hopefully, what today did for you was to give you a completely different perspective on our mission. Our mission is to improve the health of people of the region, of the people that we serve. And while that is a similar mission statement for many, many health systems, I think that most of us spend the vast majority of our time focused on that 15% of cost determinants, which is the medical system and its sick care. We really haven't addressed true health and wellness. And so whether you want to think about population health management as volume to value, or episodic care to care of a population, or paying for services to paying for outcomes, however you want to think about that, I hope you're thinking about it in a new light. And like Tom Saldine, our chairman of the system board, and I were talking at noontime, this should be terribly exciting to you, but at the same time just a little bit terrifying. And we'll scare you a little bit more tomorrow. It is a big, big challenge, especially when you figure that 85% of what's driving healthcare spending is not our core business. And we're going to have to figure out what parts of that we have to take on in order that we can deliver on our triple aim and truly lower the cost of health care. But we're doing a lot of things, and as you heard Dr. Nash say, nobody's figured all this out. There's nobody you turn to that has said, we're done, we've done it all, we now are a population health manager. It's all evolving, but as he said, we're pretty far along. And what you've heard today is about the governance restructuring that we're doing, restructuring around the populations we serve in the two regions. You heard some talk about eliminating the unexplained clinical variation. Unexplained clinical variation is what Dr. Nash used. What Dr. Swanson talks about all the time is eliminating irrational variation. Same thing. What we're trying to do is figure out when there's not a good reason to vary our care, let's standardize it and aim towards evidence-based practices. You heard Dr. Werner talking about the importance of patient-centeredness, and that's something that we've already embarked on. An example, my chart, and what you heard from Dave Buhunen, and things that we're doing to start to take into consideration, what do patients want? And you're going to hear tomorrow about the fact that things that Dr. Werner and Dr. Nash brought up, that if you're really going to do this, you got to have data. And it's not just data, because for a long time we've gotten tons of different data. It's meaningful data. It's data that we can use to change our practices to improve outcomes. And you heard about lean and the importance of our teamwork. And we have to, if Dr. Werner's right, and things are going to move towards, it's just going to be, or maybe not just going to be, but a big emphasis on competing on price, we have got to lower our costs. And we're taking significant steps to lower our costs, big initiatives this year, more coming with our efforts through lean, through supply chain, big opportunities for us. And you heard about the importance, regardless of what we do, we have to become a high reliability organization. It's unacceptable that as many patients get harmed, unintentionally, but get harmed as they do. People are putting their trust on us. These are our families and our friends and our neighbors, and one day can be us. We've got to fix this, and we've got to move towards zero harm. And you heard about the importance of using technology as an enabler, and what you heard from Dave Buhunen, and we're doing that. I'm really proud of the efforts that we're making along that. But the scary thing is that yellow box that Dr. Werner talked about, and we're entering it. We're entering it purposefully, and we do have a goal set for when we need to be to the other side. Because Dr. Werner's exactly right. Once you get well into that, when it's 20, 30% of our business is at risk, value-based, you're going to want to get to the other side as quick as you can. And we're making those preparations. So, covered a lot today. Hope that was useful for you. As you think about questions that we haven't addressed, please write those down and either take them to back to your boards or take them to any one of us, any of the people on my team will be well prepared to answer your questions, or if they're not, we'll find an answer for you.